It would allow us to travel further outside of the populous centers, right? So it would allow us to travel to less populated areas of the counties, because people who are injecting drugs are doing that all over the place. It's not just Wenatchee, and it's not just East Wenatchee. And it also would just give us a really easy identifiable way to get to the people where we want to get to them. The folks that would be running this program or would be driving this mobile unit are folks that would have some medical training, not doctors. We're not saying there's going to be doctors on board, but we do want to have people who are able to administer some, like even first responder level wound care management. The evidence in our community that indicates that we need something like an SSP is the faces and the folks that we work with on a day-to-day basis, and that a lot of providers work with on a day-to-day basis. I think one of the misconceptions about an SSP is that they will bring more drugs and more drug volume and traffic to the communities that they are in. And you know, we can't give hard data for this community because this hasn't ever existed at this level in this community. But we know that based on SSPs in other rural areas, that there is not increased drug trafficking, drug use in the communities where these programs take place. Folks who are involved in services that are working day in and day out with vulnerable community members. We know that having a low shame, low judgment, low stigma environment for folks to come to get resources means that they are going to come to those places to get resources.
We've had a good working relationship in the past with the YWCA. You've been funded quite well through the county for different programmatic things you issue. I'm a supporter of programmatics. I am an elected representative of a constituency who largely does not support this. I, in good conscience, could not represent them, and financially, on the other hand, support an organization that goes out and supports SSP programs. I don't want to seem punitive when it comes around to funding cycles for other things, but I wanted you to have all the information on your plate when you make a decision whether to do this or not.
What's your thoughts on Commissioner Steinberg basically saying, I will vote against funding for the YWCA in the future if this project is brought forward?
It's disappointing. We have all of the funding that we receive from either county is currently used for our housing, our direct housing programs and or our facilities. And we are in very good standing with those funding streams. We have always been good stewards of that funding, and we've always come through with any of the deliverables. And I might be biased. I'm not going to say we're the best housing provider because there are incredible housing providers in this community, but we provide a really critical and irreplaceable service in this community. And if that funding is taken away because of a program or a project that is completely separate and has no crossover with the funding and that has been intentional from the get-go, that feels to me like an ethics overreach, and it doesn't feel like it doesn't seem like an appropriate decision.